Welcome to this deep dive, everyone, where we're going to be focusing on the psychology behind diabetes care.
Yeah.
It's a really fascinating area, and we've got a huge stack of research papers, real-world examples, and even some insights from behavioral economics to
hmm
really dig into this topic.
I think we'll uncover some really surprising stuff.
Yeah, I think so too. By the end of this, I think you'll have a totally new perspective on how empowering patients can really lead to better diabetes management.
Absolutely. It's amazing how much psychology plays into all of this. It's not just about like the medical facts and figures.
Right.
It's about understanding, how people perceive their illness
Right.
and how those perceptions can really influence their actions in the real world.
So it's like even if you know something is good for you, like in your head, this is the right thing to do,
Right.
your mind can like throw up roadblocks.
Exactly. Yeah. And one of the most useful models, I think, for understanding this is this thing called the health belief model.
Hmm.
And basically, it looks at how people weigh the perceived threat of a disease
Hmm.
against the perceived benefits and barriers to taking action.
Okay, so I'm picturing like a scale in my head.
Yeah.
On one side, we have like the fear of complications from diabetes.
Uh-huh.
And on the other side, maybe it's the inconvenience of like changing your diet or,
Yeah. Yeah.
taking medication.
Yeah. That's a great analogy. I like that. But here's a finding from the research that I thought was really interesting.
Okay.
Oftentimes, the biggest barriers that people perceive,
Hmm.
they aren't actually practical. They're psychological.
Oh,
So, for example, they might overestimate the effort involved in making changes
okay.
or underestimate their own ability to succeed.
So it's like our minds are almost tricking us into inaction.
Yeah, in a way.
That's kind of scary, but also really fascinating.
It is. And that's where this idea of self-efficacy comes in.
No?
Self-efficacy is basically the belief in your own ability
Hmm.
to manage your diabetes successfully.
So if someone's feeling really overwhelmed, or like they don't have the tools or the support to make a change, that their self-efficacy takes a hit.
Exactly. And that can affect everything.
Wow.
Studies show that high self-efficacy is linked to better blood sugar control, healthier lifestyle choices,
Hmm.
and even a reduced risk of complications down the line.
So how do we boost someone's self-efficacy? Is it as simple as just telling them, like, you can do it?
I wish it were that easy.
Right.
It's a little more nuanced than that. It's really about helping patients develop a sense of ownership over their diabetes management.
Okay.
We call this self-management.
Okay.
And so it's about taking those daily actions, like choosing healthy foods,
Yeah.
staying active, monitoring your blood sugar,
Right.
the things that make a real difference.
But managing diabetes can feel like a full-time job, right? There's so many different things to keep track of.
It's true, and that's why I think it's so important for healthcare professionals to work collaboratively with patients.
Okay.
It's not about like lecturing people on what they should be doing.
It's about understanding their individual needs, preferences, and challenges, and working with that.
So instead of like a one-size-fits-all approach,
Right.
it's more like you're creating a custom-tailored plan for each person.
Exactly. And a key technique here is this thing called motivational interviewing.
Yeah.
And motivational interviewing.
Yeah.
It's not about the doctor dictating the plan. It's about asking the right questions to help the patient discover their own motivations for change.
What kind of questions are we talking about here?
Things like, what matters most to you about your health?
Okay.
Or what would you like to be able to do that you can't do now because of your diabetes?
Mhm.
It's about getting them to articulate their own goals and desires.
That makes sense. It's like if the goal comes from within,
Yeah,
they're more likely to be invested in actually achieving it.
exactly. And when that happens, their self-efficacy naturally increases.
Right.
The patient starts to believe, hey, I can actually do this.
So we've got the health belief model.
Yep.
We've got the power of self-efficacy.
And then we've got this collaborative approach to care.
Right.
Is there anything else we can do to help patients succeed?
Yeah, I think one of the biggest things is understanding and addressing the patient's perspective. We need to go beyond just the shoulds
Okay.
and explore the wants, like what brings them joy.
Mm.
How can we integrate those things into their diabetes management plan
Mm.
so it feels sustainable and not just another list of restrictions?
Right. I'm starting to see how all of this fits together. It's like building a puzzle.
It is.
But the pieces are like someone's thoughts and feelings and behaviors.
Yeah.
It's a lot more complex than just prescribing medication.
It definitely is. And in the next part, we're going to dive into some real-world challenges that patients face and look at strategies for overcoming them.
Sounds good. I'm looking forward to it.
Yeah, me too.
Welcome back. So we've laid the groundwork, with the health belief model and self-management.
Hmm.
Now I'm kind of curious about what are some of the real life, like, hurdles that can trip people up, even when they, have the best intentions.
Yeah, one of the sources I was looking at used this term, seemingly irrelevant decisions, or SIDs for short.
SIDs.
That
Sounds kind of sneaky.
it does.
Like, what kind of things are we talking about here?
So imagine you've been really good all week,
Mm-hmm.
sticking to your meal plan, you're exercising,
Mm-hmm.
but then it's Friday night, you're stressed,
Mm-hmm.
and suddenly that bowl of ice cream is calling your name.
Oh, I think we've all been there.
Right.
It's just one scoop, right?
Exactly. That's the tricky thing about these SIDs.
Okay.
They seem harmless in the moment, but they can trigger this whole cascade of negative consequences.
Oh.
So your blood sugar spikes, you feel guilty,
Mhm.
and then you might start thinking, well, I already messed up, so I might as well just give up on the whole day.
Right. It's that abstinence violation effect that we talked about before. Like, you just fall off the wagon completely.
Yeah, and this is where understanding the psychology behind these choices is so important.
Hmm.
It's not about being perfect.
Right.
It's about developing coping mechanisms for those inevitable slip-ups.
So how do we help people navigate those tricky situations?
Yeah.
It can't be easy to resist temptation all the time.
It's not one effective strategy is this idea of personalized problem solving.
Okay.
So it's about helping patients identify their specific triggers. Is it stress eating? Is it social pressure? Are there certain environments that make it harder?
Hmm.
And then we can brainstorm solutions together.
So, like, creating a plan for dealing with cravings or having like a go-to healthy snack
Yeah.
that you can grab when you're feeling stressed.
Exactly. It's about being proactive rather than reactive.
I like that.
And another helpful tool is something we touched on earlier, a blood glucose diary.
Right. It's like becoming a detective of your own body.
Precisely by tracking blood sugar levels
Mm.
and noting the context, like
Yeah.
what you ate, how you felt, what you were doing.
Right.
You can start to see patterns and identify those hidden triggers.
Okay.
And this self-awareness is really key for informed decision-making.
Okay, so we've got strategies for dealing with these SIDs.
Mm-hmm.
What else can we do to create like a supportive environment for people with diabetes?
Yeah.
We've talked about, family and friends, but what about the healthcare system itself?
Yeah, a lot of the sources emphasize the importance of consistent follow-up support.
Okay.
So regular check-ins, assessment of barriers to self-management, ongoing problem-solving, all of these things are crucial for long-term success.
So it's not enough to just have like one appointment and then send the patient on their way.
No, not at all.
Yeah.
We need to create a system where people feel supported throughout their journey.
Okay.
One source outlined a really interesting approach. They use mailed reminders for appointments.
Okay.
They had these self-management forms that patients complete in the waiting room,
Mm-hmm.
and then they have this collaborative discussion with the healthcare team during the visit.
It sounds like a really structured way to keep patients engaged and
Yeah.
make sure that their concerns are being addressed. Exactly. It's about fostering a sense of partnership between the patient and the healthcare team.
Mhm.
And this ties into a broader theme that emerges from the research, the importance of shifting the power dynamic in diabetes care.
What do you mean by shifting the power dynamic?
So traditionally, the doctor has been seen as the expert,
Mm-hmm.
and the patient is just the recipient of information. But this model is starting to change.
Towards like a more collaborative approach where the patient's perspective is valued
Yeah,
and their voice is heard.
exactly. One source even said that the patient is the expert on their own life, their own body, and their own experiences.
That makes a lot of sense. After all, they're the ones living with diabetes every single day.
Right, and when we empower patients to take ownership of their health,
Mm-hmm.
they're more likely to be motivated and successful in managing their diabetes.
This idea of empowerment keeps coming up.
Yeah.
It seems like a key theme in all of this, but let's be realistic. Managing a chronic condition like diabetes can be incredibly challenging,
Sure.
both physically and emotionally. Absolutely. The sources talk about the emotional burden of diabetes,
Mhm.
the stress, the worry, the feeling of never being able to truly relax.
Right. I imagine it can be quite isolating too. Always having to think about food choices and blood sugar levels.
Yeah.
Do any of the sources address this?
They do several. Emphasize the importance of providing emotional support
Okay.
and coping skills training.
Mm-hmm.
This could involve individual therapy support groups or even online resources
Right.
where people can connect with others who understand what they're going through.
It's about creating a sense of community, right?
Yeah.
Knowing that you're not alone in this journey.
Exactly. And by addressing the emotional aspects of diabetes care, we can help people develop resilience and create a more positive and supportive environment for themselves.
This has been so insightful. We've covered so much ground from those sneaky SIDs
Right.
to the power of shifting the power dynamic in healthcare.
Yeah.
I'm eager to hear how you tie it all together in our final part.
Me too. We'll be back to explore how all of these psychological insights can be integrated to create a more patient-centered
Okay.
and ultimately more successful approach to diabetes care.
Okay, so we've explored a lot of ground in this deep dive. We've talked about the health belief model. We talked about
Mhm.
self-management and those sneaky
Right.
SIDs.
There's seemingly relevant decisions.
Yeah,
Yeah.
exactly. And we've also touched on some, really important topics like motivational interviewing and shifting that power dynamic in healthcare. So in this final part, I'm curious, how do we tie all of these psychological insights together to create a more effective approach to diabetes care?
I think it's really about recognizing that psychology isn't just, this abstract concept. It's interwoven into every aspect of successful diabetes management.
So we're not just treating like a disease,
Yeah.
we're caring for a whole person. Their thoughts, their feelings, their beliefs, all of those things matter.
Absolutely. And one of the most, I think, important takeaways from the research is that successful diabetes care really requires a personalized approach.
Okay.
It's not about imposing a rigid set of rules. It's about finding solutions that fit seamlessly into the patient's life.
Like finding that sweet spot where their health goals and their individual preferences align.
Exactly. And this is where motivational interviewing can be so powerful.
Mm-hmm.
By asking the right questions, we can help patients discover their own intrinsic motivations for change rather than dictating what they should be doing.
Right. And when the motivation comes from within, are they more likely to stick with it long term?
The research certainly suggests that.
Okay.
When people feel in control of their diabetes management, they're more likely to be successful. And speaking of feeling successful, another key psychological principle at play here is positive reinforcement.
I think we've all experienced the power of positive reinforcement, right? Like it feels good to be recognized for your efforts, no matter how small.
It does. And one source put it beautifully. They said it's about catching people doing things right.
Hmm.
It's so easy to focus on the negatives, the slip-ups, the times when things don't go according to plan. But by shifting our attention to the successes, we can help build momentum and foster a sense of accomplishment.
That makes me wonder, does that apply to both healthcare professionals and the patient's support system, like their family and friends?
Oh, absolutely.
Yeah.
Everyone involved in the patient's care can contribute to creating a more positive and encouraging environment.
Okay.
And this is especially important when you consider the emotional burden of diabetes.
Right. We touched on that in the last part. The stress, the worry, the feeling of never being able to fully relax is a lot to handle.
It is. And one source even said that addressing the emotional aspects of diabetes care is just as important as providing medical treatment.
Wow.
This could involve therapy support groups or even online resources where people can connect with others who understand what they're going through.
Right. It's about normalizing those feelings. Letting people know that it's okay to struggle and that they're not alone.
Exactly. And by providing emotional support and coping skills training, we can help people develop resilience and build a more positive relationship with their diabetes.
This has been such an eye-opening conversation. I feel like I have a much deeper understanding of the role psychology plays in diabetes care. It's not just about the numbers, it's about the person behind those numbers, their hopes, their fears, their dreams. And when we take the time to understand those things, we can create a more supportive and empowering environment where people can truly thrive.
I couldn't have said it better myself. It's about recognizing that everyone's journey with diabetes is unique and there's no one-size-fits-all approach.
So as we wrap up this deep dive, what's your final thought for our listeners? What should they take away from all of this?
If I had to sum it up in one word, it would be empowerment.
Empower.
Empowering patients to take ownership of their health, empowering healthcare professionals to adopt a more collaborative and patient-centered approach, and empowering everyone to create a more supportive and understanding environment for people living with diabetes.
Beautifully said. That's a powerful message to end on. Thank you for joining us on this deep dive into the psychology of diabetes care. We hope you found it as insightful and thought-provoking as we did. And remember, no matter where you are on your journey with diabetes, you are not alone.